Hey, Team BCN. Thanks so much for joining me for today's podcast episode with Dianna Madden, Executive Director of Inpatient Care Services. In this conversation, Dianna will talk about her work at BCN and will remember and honor the work of our teammates at the St. Joseph Hospital Hospice Care Center and celebrate the 5th anniversary of the UK HCC. Dianna, thanks so much for joining us today.
Thank you, Heidi, for having me, and thank goodness it's Friday.
I know, right? I am really grateful, even though it's rainy as we're recording, I'm really grateful that it's Friday.
Yes, same.
Yes. So how did you come to work at Bluegrass Care Navigators?
Yeah, so actually yesterday was my 3-year anniversary.
Wow, congratulations.
Yeah, so this could not be more timely. Really, I fell in love with hospice early on in my career as a nursing assistant. And really just doing that work PRN, I provided like sitter services for hospice patients very early in my career, 20 something years ago. During that time, I loved that work, but also when I became a nurse, I wanted the, acute care experience. And so I never really pursued it as a full-time position until really about 4 years ago. I started at the VA as the director of their hospice unit there on Leestown Road and fell in love with the hospice population. That is really, it felt like kind of going home to something that didn't even know I missed until I found it again. And so I started there at the VA and worked there for about a year. And I wanted more of a hospice focus. The VA was wonderful, but it is, the federal government. So there was lots of stipulations and rules.
Mm-hmm.
So I wanted to really experience that, not as a hospital experience, but as a true hospice company experience. And so I started doing some digging and I knew about BCN, but didn't really know how to apply or any of those things. And so I looked online and they actually had this position open. And I thought, man, it just kind of happened very timely, shockingly. I'm not a job hopper and knew I wanted hospice, but I wanted more of a whole hospice experience. And then I saw this position online and I was like, this could not be more perfect.
Well, that's awesome. And you've been here ever since then.
Yeah.
Yeah. So you mentioned that you were always interested in hospice, even early in your career. You just didn't have the opportunity to pursue that. How did you know that you wanted to be a nurse, that it was your calling or the right thing for you?
It's funny because my mom's a nurse, my sister-in-law's a nurse, my sister is a nurse, and my sister is 13 years older than me. So it was pretty frequent that my mom and my sister, I overheard conversations from very early on in my life, well, pretty much since I've been born, about, their nursing experiences, not about specific patients, but about, just things that why they love nursing. They're both very, very passionate about it. And honestly, I never even considered another career. Like,
Really?
they both loved it so much and spoke so highly of their profession, and I saw their level of professionalism with nursing that I knew that that was what I was gonna do. I mean, lots of kids, play doctor, I was always the nurse. And so I knew very early on exactly what my career path was gonna be.
Wow. Wow. So now you are the executive director of Inpatient Care Services. How would you describe your current role?
So I think in my role as the executive director, I really see myself as someone who I'm here to make sure processes work smoothly, any sort of level of standardization that can be created amongst the entire inpatient service area. So not just Lexington, but Hazard as well. And streamlining things to make it easier for that bedside nurse. And ultimately, the process that we look at that we do standardize, that makes a better experience for the patient and the family. I
Mhm.
consider myself a problem finder and fixer, and I think that is a huge part of my role, as well as just providing that oversight and accountability to make sure that we really are giving the hospice experience that we would all want to have if it was our family member.
Mm, absolutely. Absolutely. So for you, what's the best part about working at Bluegrass Care Navigators?
I have so many things to say.
Oh, that's awesome. I love that.
Truly. I I tell everyone, and have since pretty much day one of being here, that, I primarily spent 99% of my career in acute care. And, in acute care, of course, everyone wants to say it's always about the patient. And as much as I would like to say that that's true, I really did not feel that in my heart of hearts until I came to BCN. And
Mm,
this is the first place that I've ever worked where it feels less like a company, more like a family. And at the end of the day, I know that if a patient needs something, then we will always do the right thing. And that doesn't happen everywhere. So that's probably my thing that I feel the luckiest about finding BCN.
mm, absolutely. So, as we think about our care centers and as you find and fix problems and direct and make sure that our patients are treated as we would want our families to be treated, you talked a little bit about the goals, but can you expand on that a little bit for the overall goals of the HCCs?
Yeah, I think our overall goal really is to provide patient-centered care, and that's not just for the patient, even though that is in the title. That's for the family as well. And if you do both of those things well, then that family walks away with an experience they will never forget. And I cannot tell you how special and what an honor it is for people to allow strangers to come into their lives when they are in chaos and their life is in crisis, right? Their loved one is passing away, their loved one is actively dying. And you allow, I mean, when in life do we ever do that, right? That's a private,
Mhm.
sacred moment, and yet we are afforded that opportunity and that honor. And so I think that's ultimately the goal, is to make sure that experience is exactly what the patient and family want. And then, and that starts with having really good goals of care conversations. What do you want it to look like? It's really about what they want, not what we want. Then it's our job to live up to those expectations. And I think, I'm in the community a lot, and that's a pretty heavy part of my role. And it is always so humbling to be in the community and for people to say, my mom passed away at the care center, and talk about what an ease of burden the team provided him or her or their family just because we were a part of that experience and because we made the experience for them.
Mhm.
It is truly like I cannot be more proud of the team because I hear it every single day. But I
Mhm.
think that's ultimately the goal. Like, if everyone walks away feeling that way, then we have absolutely done our job.
For sure. And I kind of what I hear you saying and what I've heard about the care centers before is it kind of becomes a home away from home, right?
Absolutely.
So walk us through what a shift on the HCC or an experience on the HCC looks like.
Sure. So, ultimately, we provide 24-hour continuous care to the patients and to the families. Our real goal is to give each patient family member truly our undivided attention. So, our team of nurses, they have more than one patient that they're caring for throughout the shift. But again, if we're doing it right, then that patient and that family member that we're spending time with in that moment feels like they're our only patient. The hospice care center, the staff are truly very intentional to make sure they provide the space and the time of making sure the patient's needs are being met. And if they're not, then they escalate those and we figure out how to get there. Um, I think that that level of detail or attention to detail really comes from all avenues and disciplines. So that I have to give some shout outs here. Our chaplain, Rhoda, like total superstar.
Mhm.
She does all of the spiritual support, and that is not exclusive to the patient and family. That is for the staff too. Rhoda has personally helped me as well. So huge shout out to her. We could not do it without her. And then our volunteer services program, truly beloved to the team. And they do I say this because it's like my favorite thing, even though they have so many responsibilities and they do so much for us. They have a fresh baked cookies program, Heidi.
Oh, yes.
Right. So truly, and like where they bake them is right next to the nurse manager's office. And when I go there, I share space with her and talk about I never realized what an impact warm cookies would bring to, like, an inpatient unit
Right,
until
it makes it
seeing
smell
it.
like home, yeah.
Yeah, until seeing it and smelling it, and then,
Yeah.
like, you totally get it. We have our integrative medicine program, truly instrumental, and that pun is intended. They they do music therapy, massage therapy, pet therapy. We have Rosie, our pet therapy dog, is one of our team members for sure.
Yes, I got to meet her yesterday
Oh,
and
she's awesome.
Matthew and all of them, so
Yes, and so, needless to say, a shift at the HCC, I think it's all about that holistic approach, and that truly takes a village, right? And every person has a piece of that puzzle, and that is also what is so awesome about working at BCN is that we get that it is not just about, kinda going through the motions and giving medicines and doing this and that. It is truly about all of those parts and pieces that make that a positive experience.
mhm. Yeah, you mentioned the family atmosphere among coworkers, but and you've talked about this before, but it's just really standing out to me about that we, in this instance, become that patient's family, like, we're an extension of that, trying to meet their needs as best we can, not just with medical care, but all the social, spiritual, all of it, even cookies.
Yeah, yeah. To see it in action is pretty remarkable, I have to say.
Yeah, yeah, for sure. So, the St. Joe Hospice Care Center closed recently, and while staff were given opportunities to move on to other positions within BCN, its closing marked the end of an era, and we want to honor that. So, as you think about the work that you and your teammates did at St. Joe Hospice Care Center, what are you especially proud of and grateful for?
Gosh, the list here is also very long. I have to say the St. Joe HCC truly led the way for a lot just in hospice in general. It had been there from start to finish for almost 30 years.
Mhm.
And in those 30 years, I mean, you can consider how many patients and families' lives we touched during those years. So we had 2 large trees where we would honor those that had passed away on the unit, and those are now located at headquarters. And when you walk past there, those are names of patients that we impacted, and those were just a few of the thousands. I think that in itself, the St. Joe Care Center was home to a lot of people, a lot of patients, and a lot of team members. So I don't want that to go unnoticed because I also have never worked at a location that had so many tenured team members in one area. It's often you might have somebody that works somewhere for 30 years, but they've had 20 jobs at a place. But
Mhm.
at the St. Joe Care Center, we had, more than a handful of folks that had worked there for the duration of over 30 years. And
Wow.
so I have to give Dr. Wisman and Chuck Teeter a shout out because they joke and say that they're part of the furniture, because truly, I mean, talk about just a staple, and they led and guided the team every single day and really made an impact not just on the patients, but the team members too. And
Mhm.
that's why those folks stayed there is because truly a family. And
Mhm.
so I don't want that to go unnoticed, and I appreciate you honoring the St. Joe Care Center because they they deserve every minute of that.
Right. What commitment, you know?
Absolutely. To the community, I mean, it truly a community staple, and we have definitely felt the loss of that, and so I think looking back on all those years, there's nobody that could argue what great work was done day in, day out, blood, sweat, and tears, and truly the team members' hearts being poured out every single day for those patients and families.
Absolutely, absolutely. So as we think about honoring this group of people, I'm sure the list of accomplishments and memories are long, but could you share a couple of those?
Absolutely. Let's see. They are long. I'm trying to pick some of the good ones. So
And it doesn't have to be limited to 2, it can be a handful, as many as you'd like.
Sure. I think, I've spent a lot of time talking about patients and families, but I really want to talk about the team members. This isn't necessarily an accomplishment per se, but it was in honor of all of their accomplishments throughout the years. And I think I'd really like to take the time to talk about it. But
Absolutely.
we did a ceremony, kind of a reception after the closing of the care center there at St. Joe. And I think the thing that resonated the most with me after having that celebration, it truly was a celebration, was that folks came that maybe had worked at the care center, like started their career there, but then had moved on to other things within BCN. And it was truly a room of folks who all had an experience at the St. Joe Care Center, kind of getting together and celebrating their own perspective of what they brought to the table and what they took from each other, right? And I have to give Whitney Clay a shout out here because she did a project where we all did a painting or a drawing. We cut it up into pieces, we put them on a table, and then we were able to recreate our own photo using other people's pieces. And the sentiment
Mm,
behind that was that everybody gives something and you also take something, right? And your picture may look one way when you started and it looks completely different when you finish. And I think for me, that was a physical image of something that had been going on for 30 years. And it truly was the sentiment that everyone in that room had given and taken.
mhm,
And it was a beautiful thing. Like it really reminded me that the accomplishments, not just about patient care, really it was a family for 30 years too.
mhm.
And I think bringing those folks in that maybe hadn't been at the care center for very long or for since a long time ago, like Dave Carper, for example, he started his career out at the care center.
Really? I didn't
Yeah,
know that.
yes. And so, now he's one of our resource officers, and he did a presentation. It was an audible presentation where they dropped pebbles, and it was to signify how many patients that we had served at the St. Joe Care Center. And I tell you, Heidi, if you've never experienced something like that, it went on for a while because it was
Mhm,
a lot of lives that were touched. And when you heard it, you realized what an impact everyone in that room really made every single day.
mhm,
So I think that probably is the biggest accomplishment of it all. Not only were they a team, and not only did they give excellent patient care, but they were a family and they were there
mhm.
for each other. And it was pretty beautiful, I have to say.
Yeah, it sounds like it. It sounds like it. Do you happen to remember the number or the ballpark number of lives that were touched?
I'm wanting to say it was 84,000.
Wow.
Yeah,
Yeah.
30 years.
Yeah. Yeah. That's awesome. Is there anything else you'd like to share related to that before I move on to the next question?
No, I just have to, we did a slideshow for the ceremony, and that was courtesy
Yeah.
of Jennifer Curtis, who's responsible for our fresh baked cookies amongst all of her other things.
Yes.
She
I
did
wrote
a
a story about that. I don't know.
no.
It's on our blog and really enjoyed the whole experience because then I got to be there for the making and a little of the sampling of the cookies too. So
Listen, I always get excited if my day at the care center is like coordinated with cookie day. We get cookies
right.
too, and that is like that's awesome. But Jennifer did a slideshow, and Jennifer was one of the folks at the ceremony that had also started her career at the St. Joe Care Center and had been involved there for the last 30 years. So, I mean, truly, again, part of the furniture. And so
Mhm.
she put a slideshow together with photos from 30 years and up to date, and talk about some funny photos and just really good memories shared. And amongst the photos, you could see, I've only been a part of BCN for 3 years, but you could see again, that family environment of having each other's backs and being expert clinicians. So I really appreciated her doing that because it really, I think, meant a lot to the entire team.
Mhm. Mhm. I can imagine. So even as we're closing one chapter, we're continuing another and celebrating the 5-year anniversary of the University of Kentucky's HCC in April. So what does this milestone mean to you and your team?
I think I can say, even on behalf of the team, it really means the world to us. UK Care Center, it has been a pleasure to partner with UK, and they make it very easy for us to function within their space. And not only do they make it easy, but they are very proactive about it. Our relationship with UK is really instrumental in regards to just getting what we need in order to take excellent care of the patient. So they do not consider us a kind of separate quote unquote company.
Mhm.
They really have embraced us as one of their own. And I think that in itself has been probably one of the biggest highlights that I'm proud of, is because that partnership really is a back and forth, and it allows us the opportunity to touch lives that maybe we wouldn't have touched otherwise. So, with the UK population, they are, very sick. And at the UK Care Center, I always say it's kind of like a hospice ICU. You have really sick patients. The nursing team there have to be very astute. They have to be very proactive, and that in itself is something to be extremely proud of. You're talking about experts in their field, and they are doing this every single day with a very sick, fragile population, and yet still providing that experience that I talked about when we first started talking. I think that 5 years, and I wish I had a number, and I'm gonna look it up, Heidi. I'm gonna
Okay.
find out what it is, because I know that, the amount of thank you cards and shout outs that I receive are, I mean, it's you couldn't even count them.
Mhm.
And these are thank you cards from families that are stating nurses' names and nursing assistants by name. And
Mhm.
so it's not generality saying thanks for your, help, and it's calling people out by name most often because those people made such an impact. And so I know that I'm very proud of the care center there and the work that we do, and I'm certain the team is as well.
For sure, because, I mean, people on that team and at BCN in general are giving of themselves because they want to, right?
That's
But
it.
it and but it's so rewarding too to know that you're going to work every day and what you do is making such a profound impact on other people's lives.
Yeah, truly an honor. It really is.
It really is, it really is. Even though I'm on the administrative side, I feel like that my role kind of connects to the team that's out there doing the hands-on work, and so I feel like maybe for one of the first times in my life that what I'm doing every day truly makes a difference for other people, so I love being on the team.
Yeah, absolutely. And it
Yeah,
definitely does make a difference. I don't think there's anyone at BCN that doesn't make a difference every single day. And I think
I
that we all somehow figured it out. It's all of those rest of the people in healthcare, they haven't figured it out yet.
right, right. So, Diana, this has been a lovely conversation. I hope people listening find it honoring and celebratory as well. Before I ask my last question that I ask everybody who comes on the podcast, is there anything else you'd like to mention that we haven't already talked about?
I do want to give a shout out to the HCC staff there at UK. Happy anniversary, first and foremost. And when I started here, you guys had only been open for a couple years. And in the 3 years that I've been here, I have seen it transform. And that is all because of the team. And so for every nurse, every nursing assistant, every unit secretary, to Jackie, our nurse manager, to Dana, our nurse practitioner, to Dr. Houghton, our medical director, and to everyone else that I think I've mentioned everybody. If I have left you out, please let me know. And I will also give you a shout out, but really to the team, and they deserve all the accolades. And so the 5 years that we are celebrating is really celebrating the team there.
Mm, for sure, for sure. So, thanks for doing that. Because this podcast is about getting to know our teammates, what is one thing that others may not know about you, Diana?
Hmm. I I guess probably most people don't know this about me. I consider myself what I call and I've just like created this term myself, a step ladder nurse. I started my career out, I was beating down the door literally before I was 18. I couldn't start until I was 18, but I was waiting in the wings when I was 17, wanting to get my feet into healthcare. And I started as a nursing assistant and then went to licensed practical nursing school, LPN school. And then I did that for a few years and decided to go back and went back and I got my associate's degree in nursing. I went back again and went to get my bachelor's degree in nursing. And then I went back again. I got my degree in master's in nursing administration. And then I went back again and got my doctorate in nursing. So I took like the way long way around, but I think it really did make me really appreciate every step of the way.
Mhm.
So I feel like I have been there and done that. And
Mhm.
that has really opened my eyes to a lot of the struggles that really do happen in each one of those steps, right? I was a
Mhm.
secretary for years on a unit as a nursing assistant. I kind of did both jobs. And every one of those experiences led me where I am today. And I think made me a better leader, a nursing leader. And I think it made me a better person in general. So,
Yeah, I can totally see that because, I mean, it's great if you, because a lot of nurses get their bachelor's degree, like, from the get-go,
right.
but I think having those separate steps, like, you're doing it, you're going out and practicing it, and then you're like, "I want more," and you're going back, and then you're doing that for a little bit, and then you're like, "I need more of this," and, you just build on the classroom with practical knowledge as well, kind of doing it the way you did.
Absolutely. I forced my sister to go back to my doctorate program with me. So the sister that I admired and looked up to for all those years, and I knew I wanted to be just like her. When after I'd finished my master's, she already had her master's. I said, "Well, I think we need to go to our doctorate program." And she was like, "Really?"
So you raised the bar, like, you looked up to her,
Absolutely.
but then you were like, "Here's the bar, now we're gonna go do this."
Yes, and she has said more than once. She's like, "I would have never went if you hadn't forced me," and I knew that, but it was pretty awesome to have that experience with her as well. But
Yeah, yeah. I think that's great. I mean, because if you're gonna go to school, it's good to have somebody going alongside you too, because it's
absolutely.
a bit challenging, especially when we're not the typical 18 to 22-year-old.
Right. And I took the way long way around about doing that, but I do think that it really did make an impact on me. So
Yeah, for
positive.
sure. For sure. Well, Diana, thank you so much for sharing today and honoring the team. And I just appreciate your time. Thanks so much.
Thank you.